Hi everyone, thank you very much for joining today. So my name is Lottie and I am the ESS Nutrition and Wellbeing Officer. Thank you for joining us on our Wellness Wednesday. So today's webinar will be on women's health and we'll be looking a bit about the biological cycle of a woman and then a couple of issues that affect women specifically throughout their lives. So just in a bit more detail, so we'll start with the life cycle. We'll then just talk about women's health in general and factors that affect women's health. We'll then talk about breast health before discussing a bit about the menopause and then a little summary slide as well with some key takeaways. So as some of you may know, October is Breast Cancer Awareness Month. So that's why that is one of the focuses for this webinar. And then the 18th of October is World Menopause Day. So again, that's why we've chosen these two topics as a focus for today's session, because as you may or may not know, women's health is a very large subject and it's hard to kind of put it all into half an hour. So we thought those two topics would be good to start with today. So then just looking at a woman's life cycle. So typically it is split into about 5 different biological life stages. So you have infancy, so this is when you're born and you're a child, going into adolescence. So this is typically around the ages of 10 to 19. You then have sexual maturation, so this is your reproductive age. And then you have the climacteric period. So this is typically about 5 years before and after the menopause. And menopause typically happens between sort of mid-40s to mid-50s, but we'll talk about that a bit more later on. And then going into the post-climacteric section, which is kind of the elderly stages. This next slide sort of is a good slide because it shows lots of different life stages and related mental health issues and also diseases which affect women. It's quite a busy slide, so I'll leave it up for a minute or so for people to have a look at. But essentially the blue line is the level of female hormones being secreted. So as you can see, they increase during puberty, so during adolescence, peak during your reproductive age, so the sexual maturation, and then they decrease down into the climacteric period. So that's when the menopause starts. So you can see lots of different factors on there which affect women. I just thought that was quite an interesting diagram to put on there to see all the different factors. So then just a bit about general women's health. So there's lots of different factors which can affect women's health. It's not just about being sick or injured, but things like your general well-being, any medical conditions. So this could link to either gynecological conditions or also cardiovascular. You've then got your physical health, screening, so this is checking for any injuries or any potential diseases, and then mental health as well. So as you can see, women's health is very complicated. You can't just sort of put it into one box. There's lots of different factors which affect it, and they all link in together as well. So that's just something to be aware of. One statistic that I found when researching this is only 59% of women actually feel comfortable talking to a healthcare professional about mental health. On the flip side, about 85% of women feel confident speaking about physical health concerns. So you can see there is still a bit of a gap between people wanting to come forward and talk about mental health. But as you know, it's really important. So I just thought those two contrasting statistics were quite interesting. A lot of the time when you talk about health, people instantly think of physical health, but mental health is a big factor as well. So now we will go on to the first topic of today's webinar. So this is all about breast health. So starting with breast lumps. So these can occur in either the breast or the armpit. And most are harmless, but some can be more serious. So if you do notice a lump appearing, it is important to get it checked by your GP. So there's sort of 2 different types of lumps that can occur, as you can see from the diagram on the page. So you can get breast cysts. So this is where there is a buildup of fluid around the gland. So you can see that on the diagram on the left. And then the diagram on the right is something called fibroadenoma. And this is kind of harmless, non-cancerous tissue growth. but both of those can form lumps, and both of them should be sort of get checked out by the GP if you do notice any changes. I'll talk more about breast changes in a couple of slides, but yes, those are the two kind of main causes of breast lumps. So then we talk a little bit about breast pain. So breast pain can be very common and linked to your period, so can happen up to about 2 weeks prior to your menstrual cycle, so when your menstrual bleed, so 2 weeks prior to your period, perhaps a very dull pain or maybe aching, and it can affect both breasts or just one, and can also spread up into the armpit as well. So that's when it can link to your periods, but there can also be other causes for breast pain as well. So people might get painful breasts during pregnancy. Some different medicines can cause breast pain. So these include perhaps the contraceptive pill, or also some antidepressants can also cause breast pain. If you have a sprain or you've injured your back or your neck or shoulder, this can also be felt in the breast because of the tissue that's kind of all surrounding that area and linked. Perhaps if you've carried out some physical activity and you've strained yourself, perhaps doing some arm workout, then that's why you might feel that pain in your breast. And then also there are hormone changes during the menopause, which can cause breast pain as well. So they're just all things to be aware of when thinking about breast pain, if you have noticed that. It's also worth noting that although breast pain on itself is unlikely to be a symptom of cancer, it is still important to get checked out if the pain doesn't improve. So not necessarily something to be alarmed by, but always best to get it checked out if you are noticing that pain for a prolonged period of time. So then we talk a bit about breast screening. So this is known as a mammogram. So women will automatically be invited for a mammogram initially every 3 years. So once you reach 50, you will receive a letter by your doctor and you will be invited to your mammogram. So you go every 3 years between the ages of 50 and 71. What they do, so you can see from the image on the screen, it's an X-ray. So what they do is they take 4 breast X-rays, so they take 2 for each breast, and you can see there the breast kind of goes into almost a clump, and the X-ray comes down from above, so that they can screen and see if there's anything that is too small to be felt or too small to kind of have been noticed. So initially, essentially, it looks for any breast cancers which might be too small to see. It's all thanks to mammograms that survival rates have doubled in the past 50 years, thanks to screening, diagnostic advances, and also treatment. So some people do feel a bit uncomfortable going for a mammogram, but it's always with trained professionals, always female. So they'll carry that out and they'll talk you through it if you are nervous. But once you do start receiving that letter, you should definitely get booked in. Very quick session, and it can help to put your mind at rest and also screen for anything that might be too small to see. So it is really important to make sure that you do go to your breast screening appointment. So about 2,300 women under the age of 40 are diagnosed with breast cancer every year. So that's just a stat about the prevalence of breast cancer. And then on this slide, I'll just talk a bit more about breast cancer in more detail. So what is breast cancer? So breast cancer is when abnormal cells grow and form a tumour. These cells can either form in the lines of the milk duct, so this is the most common place where they may grow, or it may have spread to another part of the body, such as the bone. So this is when it's known as secondary breast cancer. So causes, there are no specific known causes, but your risk factor for getting breast cancer might be increased if you are overweight or if you have increased alcohol consumption. So that's above the recommended 14 units a week. In older age, and also family history can increase your risk factor as well. So then what are the signs and symptoms? So this could be anything from change in the size, the shape, or the texture of the breast, perhaps having leaking fluid from the nipple, or also a nipple changing position. So lots of different symptoms there and signs which you can look out for, and that's why it's really important that we do check our breasts. I've got a slide on that in a minute. So what treatment is there available? So it often depends on the location, the health of the individual, and also the size of the tumour. But a lot of people start with surgery. So this could be a lumpectomy or a mastectomy. And individuals may also choose to have surgery to remove the lymph nodes in the armpit where cancer cells are broken away from the breast tissue. Other main treatments may also include chemotherapy, radiotherapy, hormone therapy, or also targeted cancer drugs and immunotherapy as well. There's lots of support available. There's lots of different cancer charities out there. Just to name a few, you have Cancer Research UK. You also then have Copperfield. So this was founded by a lady called Chris. She founded this charity after she developed breast cancer herself and kind of raised awareness for Copperfield. So checking your breasts and raising awareness over the importance of that. You also have Breast Cancer Now, which is a research and support charity, and then Macmillan too. The NHS website also has a lot of useful information about breast cancer if you wanted to read more. But if you do have any concerns, the best place is to book an appointment with your GP to get checked out. So then checking for your breasts. So it's really important that we do this. So Breast Cancer Now have come up with this method called touch, look, check to make it very simple for people to check their breasts. So touching, you want to have a good feel. Do you notice anything new or unusual? Look, can you see any changes? Does anything look any different? Perhaps a new dimpling, a rush, anything like that. And then also just to check, so go to your GP and get any changes checked out. So it's important to look at all parts of your breast. So this is all the way into the armpit and up to the collarbone. And no matter whether you have large boobs, small boobs, whatever shape or size you have, we should all be checking regularly. A lot of people find it easier and more comfortable to check in the shower. Perhaps they've got shower gel and they can kind of it's smoother to be checking, but whenever you feel is right for you, it is important to be checking your breasts. And also it's important to mention that it's not just for women. Men can also get breast cancer as well. So they need to be checking their breasts too. So then again, this is taken from Breast Cancer Now. This is just some common signs of breast cancer. So you can see either a lump or a swelling, change in colour, perhaps there's an unusual liquid or a discharge from the nipple. But again, these illustrations are just a guide. So anything that you have noticed that feels different or abnormal, it's worth just booking an appointment on with your GP, sorry. So then we will talk a little bit about the menopause now. So just understanding a bit about the menopause. So what is it? So this is a point in time when there has been no menstrual period for the previous 12 months. So that means you've not had a bleed in 12 months previous. That is then when you are said to be having the menopause. And it affects anyone who has a period. So when does it happen? So in the UK, the average age of a woman going through the menopause is 51, but it can occur naturally between the ages of 40 and 60. Obviously, some people might be earlier, some people might be after that, but those are kind of the typical years in which you may experience it. It can happen due to surgery. So perhaps if you've had your ovaries removed or your uterus, or certain cancer treatments like chemotherapy can also bring the menopause on sooner. Or sometimes it just happens for an unknown reason as well. There's lots of different symptoms, but just to pick out a few, some women may experience anxiety, mood swings, brain fog, so struggling to concentrate, perhaps making more mistakes, feeling less confident as well, hot flushes, also sweats, and irregular periods as well. So that can be in the period before you haven't had your bleed for 12 months. Then looking at treatment. So HRT you may have heard of. So this is hormone replacement therapy. This uses estrogen to replace your body's own levels. So the menopause occurs when your own natural estrogen levels start to drop. And that's why you then end up not having a period because your estrogen levels have dropped. So that's why HRT helps to kind of replace those estrogen levels that you've lost through the menopause. Another method that people have for treatment is CBT. So this is cognitive behavioral therapy. This is a talking therapy where individuals can discuss their physical symptoms, their low mood, their anxiety. So although it may not relieve the physical symptoms, it can be still really good to sit down with a group of people and discuss what they're going through and what kind of how it's impacting other people. So CBT can often happen as group sessions or one-to-one sessions as well. Again, there's lots of support about there. Two of the big charities are the Menopause Charity and then also Menopause Support. Again, the NHS website is really useful for information on the menopause. There's lots of facts and understanding on there, or if you do have any concerns, you should book an appointment with your GP to discuss it, especially in terms of any treatment if you do have severe symptoms. You may have heard of something called perimenopause. So this is when you have all the symptoms of the menopause, but your periods haven't stopped. So you might be having the brain fog, the hot flushes, the mood swings, but you are still having your period. So this is what is known as perimenopause. So if you've heard that word banded around, that is what that means. There's then also something called the early menopause. So this happens if you have the menopause before you're 45 years old. So the main symptom here can be not having your period regularly or your period stopping completely, and some possible causes for the early menopause. So perhaps if you started your periods really early and you went through puberty before the age of 8, that can be a contributing factor to then bringing the menopause on early. Some people who have never given birth or only given birth once or twice may also go through the early menopause. Smoking can be a factor as well. Also, being underweight can increase your risk of having early menopause. And then also being hereditary, so it running in the family, it's more likely that you'll go through the early menopause, perhaps if your mother or your grandmother have experienced it. So that's why it's always good to be open. If you can talk to family members about this and understand when they went through the menopause, that can kind of help you prepare yourself. Obviously, everyone is different, but it's just good to be aware. The early menopause affects only about 5% of women, though, so it is a much smaller number, but that is still 5%. So again, just something to be aware of. If you do think you're experiencing those symptoms, but you think, oh, you're too young, it might be that you are actually going through the early menopause. So then a bit of nutrition advice. Optimizing your nutrition can help to support your menopause symptoms. So protein, women are at a greater risk of osteoporosis. So about half of all women over 50 will suffer a fracture due to poor bone health compared to 20% of men. So that's why where protein comes in, so really important to reduce muscle loss and also help to maintain healthy bones. Protein can also help with the production of serotonin, which is important for your mood and also your brain function as well. So examples of different proteins are things like pulses, beans, but also meat sources, so chicken, beef, pork, and also eggs as well. And then you also have tofu as well as a plant-based option. Next, we have fiber. So it's really important to help increase the diversity of the gut microbiome. It's also thought that having enough fiber in your diet can help to support your mood and also manage any anxiety. So examples of this, try and eat a wide variety of fruits and vegetables, try and eat a rainbow across different colours. So you're getting fiber from lots of different sources, and also your whole grains. So this is things like your brown rice and your brown pasta. So then dietary phytoestrogens. So these are naturally found in a variety of different plant foods, including soya, and it's thought that they can relieve hot flushes. So about 70 to 80% of women in the USA have menopause hot flushes, compared to about 10 to 20% of Asian women where soya intake is much higher. The dietary phytoestrogens have a mild estrogen effect when they're consumed regularly. So again, helping to replace the estrogen that you're losing once, or is decreasing, the levels are decreasing when you're going through the menopause. So lots of different soya products, but this includes tofu, edamame beans, miso, and also tempeh. The phytoestrogens are often found in other food sources, so things like flax seeds, lentils, chickpeas, broccoli, and also dried apricots. Then we come on to heart healthy foods. So these are really important to ensure that you keep your cholesterol levels down. So about 77% of women aged 45 to 64 have high cholesterol, which in turn can increase your risk for heart disease. So in terms of looking at diet here, the Mediterranean diet is one of the most beneficial for having a healthy heart. So you may have heard of this. This is essentially where they eat lots of unsaturated fats, so swapping saturated fat for unsaturated. Sources include things like avocado, your olive oil, and also your oily fish. Oats and barley contain something called beta glucan, which can help to lower your blood cholesterol as well. Then lastly, we have vitamin D. So vitamin D is very key in supporting bone function and also immune function. So vitamin D is a fat-soluble vitamin, which means it is much better absorbed alongside a meal containing some kind of fat, ideally unsaturated fat. This makes sure that it all gets absorbed by the body. Sunlight is a natural source of vitamin D. However, some food products are fortified, such as some mushrooms and also in some cereals as well. It is recommended that between the months of October and April, people take a supplement in the Northern Hemisphere, because obviously our sunlight source is a lot shorter. Our days are a lot shorter, so we don't have as much exposure to sunlight, so we're often not getting our vitamin D levels. So if you're someone that does work inside in an office inside all day, do make sure that you are taking your vitamin D supplement. So then I've just got a little summary slide about what I have spoken through today. So women's life cycle and health, obviously I've spoken about the level of hormones, so your secretion. Important that you check your breasts regularly and see your GP if you notice any changes, either any physical changes or you notice anything through feeling any lumps, or also any prolonged pain as well. Then make sure that you attend your mammogram. So these are your breast x-rays when you get invited. So that is the ages of 50 to 71. And then lastly, we have the menopause. So this occurs due to the natural decline in estrogen levels and typically happens between 45 and 55 years old. In the UK, the average age is 51. And increasing your protein, fiber, and phytoestrogens in your diet may help to alleviate some of the symptoms I mentioned. And the early menopause is when you have the menopause before you are 45 years old. So I appreciate that was quite a whistle-stop tour of women's health, in particular breast health and also the menopause. So before we go on to any questions, I just want to raise your awareness about us as a team you may or may not be aware of. So you can see this poster here. You all have access to ask your nutrition and wellbeing specialist any questions. So that is myself and also Leanne. We have our email, which is on the screen. So that's ess.wellness@compass-group.co.uk. You can contact us for any personal wellbeing queries. We can then organise a one-to-one, see how we can help you. Perhaps you'd like to book an educational talk for your unit or your site. We can come in and do this as well. We do also offer virtual solutions too. We then can also attend health fairs and bring a stand with a variety of leaflets covering lots of different educational topics. We then also produce our wellness magazine. So you may have just seen our autumn magazine come out. So we cover a wide range of different health and wellbeing agenda topics. We try and include some personal accounts as well to make it more relatable. And you should get that in your inbox if you've signed up to these webinars. If you haven't and it's something that you would be interested in, do just send us an email, same email that I mentioned earlier, and we will get you on that mailing list so that you have that. We're currently working on our 12 days of wellness, and then we have our winter magazine, which will come out in January as well. And then lastly, you're all here on the webinar today, so that's great. Thank you so much for joining. I hope you have had some interesting bits to take away. But if you know of people that haven't made the webinar today, we do upload them onto our YouTube channel. That's We Are ESS. There's lots of different topics that we've covered. So this year already, we've done heart health, digestive health, general nutrition and wellbeing. So lots of different topics there, which you might find interesting to go and look back on. What I will do is I will come out of my slide share and just see if we have any questions that have been submitted. If you do have a question but you don't want to ask it in this session, that's fine. Do just drop us an email. I'll put the email back up just in case you would like to contact us directly. And if there's no questions, what I will do is I will close the webinar for today. So thank you very much, everyone, for joining. I hope you've had some opened your knowledge to different parts of women's health, perhaps got some bits to take away and discuss with colleagues. So yes, thank you very much, and we will see you next month for November's wellness webinar. Have a good afternoon.